Hello, my name is David Navarez, and today we'll be doing a presentation over dietary supplements as an alternative health source. So dietary supplements are easy to consume and manufactured pills, tablets, powders, or liquids, which contain both micro and macronutrients that are used for the aid of filling in the gaps of nutrition that we might be missing in our daily food intake. As of 2021, 1 in 10 children and adults were consumed daily needed vegetables, and 4 in 10 children and 1 in 7 adults consume adequate fruit per day. This was by the CDC, and this is alarming. So people obviously are not getting the micronutrients that they need, and as much as we would like to hope that they would eventually, it might not always be the case. So it is recommended generally that people take a daily multivitamin to help combat micronutrient deficiency. Additionally, the longer process that it takes for food to get from soil to plate reduces the nutrient density of the food, which can also contribute to a deficiency in certain nutrients. So obviously there is a need for it. What can it be used for? Well, it can be used as a preventative safeguard in pregnancies for developing fetuses and for mothers to take prenatal vitamins. Trinate is a common one, and it can help make sure that fetuses aren't at risk for developing prematurely, having low birth weights, or having serious neural tube defects due to a lack of iron or lack of folic acid. As a couple examples, folic acid directly linked to serious neural tube defects, and iron being linked to prematurity and low birth weight. So, for that reason, as a safeguard, it is a great option. In specific cases. Also can be used to reduce identified nutritional deficiencies, which is a more patient by patient basis. So if lab work shows that vitamin A has been deficient in a patient for 2 consecutive times that they've been into the provider, it could be advisable that a vitamin A supplement may be helpful to prevent long-term vision damage and to aid in reducing eye dryness. That's more of like a person by person case basis on specific nutrients and supplements. Limitations. A one size fits all approach is not necessarily the best approach, and it's not always possible. Or at least not always effective. So, there was a study done by schools in 2020, which assessed the efficiency or the effect of vitamin D and calcium supplement to prevent fractures in community dwelling adults. It was found that the combination was not associated with a reduction in fracture. However, benefits were found in specific patients who were at risk due to osteoporosis or vitamin D deficiency. So again, a case-by-case basis, it can be helpful. A general approach, not so much in many cases. And it's not the solution to poor overall dietary intake, and it's not a miracle cure. So if you hear, oh, this supplement can cure cancer, well, that's not necessarily, I guess, the most accurate to put it nicely. And it's not a cure to eating pizza and fast food all day. As much as it's helpful, the importance of a holistic diet, using my plate, for example, is still important and cannot be replaced by the use of supplements. Precautions, specifically, we need to be consulting providers and we need to promote this for our patients and general population because it can have serious interactions. A person is suffering from depression and has a selective serotonin reuptake inhibitor currently, and then they hear St. John's wort is good for this. So they start taking that, not knowing that that interaction can have with an SSRI can lead to serotonin syndrome, which can be fatal. So that is just one example of a way that this can go really wrong if not talked about with the provider. Overconsumption is a risk. You start feeling better because you're taking, say, a potassium supplement. So you start taking way more, which leads to hyperkalemia. That can have serious results and complications, cardiovascularly speaking. Children's access to parental supplements is also a concern. We need it to be locked away just like a medication would be because overdosing on whatever vitamin and mineral can happen, especially if a kid gets a hold of it. They have much small body mass index and they can easily consume way too much as kids would. They put everything and they eat everything. So that's a serious concern. Supplementation purchases of young adults is also concerned, specifically in young male populations. We've seen an uptick in the amount of testosterone boosters and creatine and other supplements that they take based on social media, promoting a false image of what's realistic, and also influencers promoting unrelated or unscientifically based promotions for financial gain, which in turn convinces a young young male to go and purchase these things, such as test boosters and creatine, which can lead to problems with kidney and liver function. So these are a couple areas of concern, generally speaking, that I found regarding the use of supplements currently. So how to incorporate into care? Well, as a nurse, we want to do a complete nutrition assessment, 24-hour dietary recall, assess physiologic features such as brittle hair, dry skin, muscle wasting, and general weakness. Those could be signs that there is a lack of nutrient-dense food. And also assessing height, weight, BMI, lab values, electrolyte, and minerals. These are assessment pieces that we can do both inpatient and outpatient places that help us determine what our patient might best benefit from. We want to communicate these concerns with our provider, with dietitians, and get them pointed in the right direction for if a supplement is needed, what is the best choice for them, and what do they really need to take. We also want to inquire with our patients about the current supplements that they do take and relay any information to the provider, and also identify any potential interactions that they might have with current medications that they take. Uh, Education is on common high risk interactions, specifically on common high risk interactions with medications they take. It's also important. As we know, vitamin K, antidote to warfarin, if they take that in conjunction, it would not, warfarin will have the effect that it should, which can be lethal in certain cases where anticoagulation is truly needed. Also, spironolactone and potassium, those taken together, potassium can, as we talked about before, turn into hyperkalemia. Too much potassium can have serious effects on heart rate and rhythm. So, what patients need to know: supplements are a valid form of alternative health, but they also pose risks, both of toxicity and of interactions. Furthermore, social media poses more challenges now than ever before, which makes it even more important that medical professionals be consulted before starting or stopping any supplement that they have been taking based on medical professional advice. So, it does have a place in healthcare, but it also has its risks. So, we have to be very careful with how we choose to interact with them and how we choose to consume them. It shouldn't be based off a few ads or a few influencers guiding and pushing information rather than from medical professionals who really know whether this is a need and a safe option for you personally. In conclusion, physiologic health and wholeness, we can achieve those things without supplements. They aren't needed, but and however, they can be a great aid. Needs of supplements are individualized. So because a family member suffers from anemia and they take an iron supplement, have been feeling a lot better, a lot less dizzy, a lot more with a lot more energy, that doesn't mean that another family member needs to take that as well. Just because a social media influencer insists on testosterone boosters to achieve massive muscle growth and strength does not mean it is safe and a correct option for you as a 16-year-old or 15-year-old or of really whatever age. So consulting healthcare professionals is imperative, and nurses play a key role in keeping patients safe. As nurses, we have the obligation to assess what patients might be in need of and communicate that with providers. We also have the responsibility of assessing what they do take already and if they are uh, potential for interaction or potential for harm. We are kind of the eyes and ears of physicians and of patients themselves who might not know any better. And with that responsibility, we need to be extremely diligent. Also, with added misinformation from social media, education is even more important on our part to make sure that they're not getting filled with just the information that Twitter has to supply, but rather what science and what the current evidence-based practice has to supply. So, question one: have you ever known anyone who bought a supplement based off a social media ad? And do you think there are any concerns with this form of marketing to the general population? I'm curious to see your opinions on this. And of kind of a follow-up question is, what can we do as healthcare workers to help combat false supplement information provided via social media outlets? So thank you for listening. That is a conclusion to my presentation. I hope it was of some use. And here are my reference list if you guys have any questions how I got my information. Thank you very much.